how come we don't help children's jaws grow properly in the first place? And so in that course, I found research to suggest that children that had palate expansion, it could help reduce their snoring and alleviate obstructive sleep apnea. And I thought, how come we're not doing this more often for children? We're taught in dental school you can do palate expansion, widen jaws, age 7 to 8 years. But then typically when we referred patients to an orthodontist, they would be told, oh, we can watch and wait. Let's just wait and wait and wait till age 12. Then we're taking out teeth to alleviate dental crowding and trying to make the teeth straight with braces. And I thought there has to be a better way. And so that's when I decided to learn more about early interceptive orthodontics to modify children's jaw development.
Welcome to Spoil Your Baby podcast. I am so excited to connect myself and you all with Dr. Shereen Lim. Dr. Lim is a dentist with a focus on airway health and early development and is the author of Breathe, Sleep, Thrive, which I've got my own copy of right here and lots and lots to learn there. So welcome. Thank you, Dr. Lim, for being here.
Yeah, thanks very much for having me. I'm excited to be here.
Wonderful, wonderful. So let us get to know you a little bit. How did you arrive in this, in this world of breathe, sleep, thrive?
Great. Yeah. So I've been a general dentist for 26 years, but I first became involved in snoring and sleep apnea through my husband's snoring. So 12, 13 years ago, I think it was, his snoring was really bothering me. I was so frustrated. I wasn't able to get to sleep. So one day I just woke up in the middle of the night and I started researching dental sleep appliances because I had an understanding that you could have these dental appliances that would help alleviate snoring. Right. And I decided that I was going to enroll in a program to learn all about these and help other spouses in the same boat.
I love that. It comes from your own.
So during that course, I came across research to suggest that because I was wondering, okay, we're making these dental devices, they bring the lower jaw forward. How come we don't help children's jaws grow properly in the first place? Yeah. And so in that course, I found research to suggest that children that had palate expansion, it could help reduce their snoring and alleviate obstructive sleep apnea. Mm-hmm. And I thought, how come we're not doing this more often for children? We're taught in dental school you can do palate expansion, widen jaws, age 7 to 8 years. But then typically when we referred patients to an orthodontist, they would be told, oh, we can watch and wait. Let's just wait and wait and wait till age 12. Then we're taking out teeth to alleviate dental crowding and trying to make the teeth straight with braces. Yeah. And I thought there has to be a better way. And so that's when I decided to learn more about early interceptive orthodontics to modify children's jaw development. And in 2014, I went to a conference where I met Dr. Christian Guilleminault. He's a pioneer in dental sleep medicine. He helped to discover obstructive sleep apnea. And I told him his research on palate expansion in children, it really has inspired me to learn more how to offer this to children. And he said to me, if you're doing palate expansion, you're too late. And I had no idea what that meant. It was like over 10 years ago. But I soon came to realize form follows function. If the jaws are not growing properly, there's some oral dysfunction where the muscles have not worked well during sucking, swallowing, and breathing in the earliest years of life. And so that's where my attention is now more focused on. How can we get children's tongue and other muscles to work well early on so we can promote better jaw development?
Wonderful, wonderful. So when we talk about airway health, I think we're always, in my world, connecting it with sleep and brain development and cognitive development. It's all interrelated. But often we have families whose babies are waking up very frequently. Mm-hmm. I actually experienced this as a young baby as well. I think there were many reasons why I woke up a lot, but one of them definitely was airway health. So for parents who've just sort of never heard of it, what are we talking about when we say airway health? I think you kind of touched on it a little bit, but tell us a little bit more.
Yeah, so airway health is really about promoting optimal breathing as early as possible. And what that means is nasal breathing 24/7. So we're designed to breathe through our nose and really having good airway development, especially in the earliest years of life when the jaw structures are growing. So we want optimal jaw development. And because the jaws are influenced by the oral function, we want to promote good oral function as well. So that means really good tongue suction during sucking, swallowing, and breathing, and promoting good chewing habits as well.
Mm-hmm. Yeah, well, so important. And I always want parents to know the information, but not be scared about it too, because it's easy to miss. It's, hopefully people hear this interview and hear and come across this information, but sometimes it does happen later. But, given that, can you tell us more about how airway development does shape a child's sleep and mood and behavior and cognition and things like that?
Yeah, definitely. I mean, we are supposed to breathe through our nose. Apart from warming, cleaning and filtering and humidifying the air before it enters our lungs, when we close our mouth, and when we have our tongue sucked to the roof of our mouth, it's the optimal breathing. It keeps our airway open. So, for instance, if we try to snore with our mouth open or snore with our mouth closed, it's easier to snore with our mouth open. And this is when we're going to get disruptions in our airflow and have snoring, which is leading to more fragmented or unrestorative sleep. Or down the line, if it's unaddressed, it can become obstructive sleep apnea, which is when we have complete pauses in our breathing that can last for seconds, that can be associated with oxygen deprivation. And so when we have snoring or mouth breathing, it does lead to more unrestorative sleep. And we know that there's a lot of research to support that snoring is linked to increased risk of behavioral and learning problems in children. The brain, as we know, is growing the most in the first 3 years of life, and that's when children need the most restorative sleep. And apart from the hours of sleep, we need to check that breathing quality during sleep as well. So yes, we have those type of issues as well. So really promoting airway health or that nasal breathing and good jaw and airway development, it's really the foundation for thriving health and vitality across the ages as well.
Yeah, I ended up having obstructive sleep apnea and having my tonsils and adenoids removed. But we were talking a little bit before that I needed a bit more than that too. If I was born now, I might have gotten even more care, which is important that our kids are getting better care now. What can parents do to promote airway health? We'll talk about what are the signs of if it's not going well. But before that, what are some things that we can do for our little ones to promote it?
Yeah, I mean, so airway health being nasal breathing, we want to make sure that children can grow up with their mouth closed. And just pay attention to that. Are they breathing through their nose from the earliest years of life? So how do we promote that? Obviously, nasal hygiene, nasal sprays, non-medicated saline sprays to keep that clear. We also want to make sure that the oral muscles are working really well because that will promote good jaw development. And really, we have to understand that the jaws are our outer borders of the airway. So when you said in childhood, you have the adenoids and tonsils removed, a lot of people think that the airway, to address the airway, we have to go to an ear, nose, and throat specialist to remove tissue outside of the nose that could be blocking it. But there are it's a multifactorial issue. It's not just what's inside the airway, but we have to look at the outer borders of the airway. How big is that airway? So that top jaw is really the palate. It's the floor of the nose. So we know that when we widen the palate, it can increase nasal airflow, or it makes airflow smoother, and it makes more space for the tongue so that the tongue can rest more properly in the roof of the mouth. And that will also help to keep the throat open during sleep. And so the jaws, the position of the jaws, we want those jaws forward. If they're more back, it's a more pinched airway as well. And so your question being, how can we promote good airway health? And that is really to consider that good breathing is not just about what's inside the nose and the throat, but it's about the jaw structures and making sure the jaw structures are going well. And if we want those jaw structures to go well, the things that we can modify, number one is breastfeeding. Breastfeeding is really nature's palate expander. When we have good breastfeeding and optimal latch, that tongue is required to suction to the roof of the mouth, and it extracts the milk through a vacuum. So as the tongue drops down, that's how milk is transferred most efficiently. And it requires a complex coordination of muscles that brings that lower jaw back and forth. So it really develops the jaws forward and wide. So breastfeeding is really important, and understanding optimal latch mechanics, because sometimes you can breastfeed without pain, with good weight gain. But if babies are getting a shallow latch and they're using their lips and they're not really using their tongue correctly, that will not promote the full jaw development. And then we look at things like pacifier use. If we use pacifiers, that'll actually lower the tongue posture. So it keeps the tongue down, so that tongue is not able to provide that expansile force to develop the palate well, but it also increases sucking forces, which actually collapse the jaw structure. So it changes the whole swallow pattern. And the impact is related to the frequency, intensity, and duration of pacifier use. So a lot of parents might think, I just use the pacifier at nighttime only. However, babies are sleeping, they're sleeping for a long time.
Hours of the day,
that can create considerable impact. We know that pacifier use is related to orthodontic problems at age 4, but that really is a reflection of poor jaw development. So that's, looking at the oral function in that way. What else we need to promote good jaw? Chewing as well. So a lot of babies, we introduce purees or sippy pouches, sippy cups, and the pouch food, where we're not really promoting good jaw activity, and that's more sucking again. So that's constricting the jaw development. So these are the things that we need to pay attention to, making sure that children have clear noses, their muscles are developing properly. And in that first year of life, they're the most modifiable things that we can pay attention to. And if parents cannot breastfeed for any reason, just to recognize, I think our role is really to educate people on the mechanical benefits of breastfeeding. And there are always reasons why some people can't do it or choose not to do it, but letting them know that it's multifactorial. There's other options that we can do, and these are the things that we need to focus on. But I do think, a lot of babies that are relying on pacifier use, we have to ask, why are they relying on it? And I do find that I'm involved in tongue tie management. So a lot of the time when children have tongue tie, they're not feeding optimally. They are sucking a lot of air, sucking and swallowing a lot of air, and they may have reflux-like symptoms. And so sometimes they've got a lot of trapped wind, and that pacifier can really help comfort them. So before medicating children for reflux, adult medications that aren't particularly proven, we need to make sure that they're getting optimal latch and they're not swallowing air as well.
Amazing. Yeah. I think it's so important. I love what you said of like the palate is part of the sinuses, or did you say the lower part of the nose?
Yeah, the floor of the nose.
The floor of the nose, yes. And that's a beautiful thing to think about. And I don't think a lot of people know that that's one of the benefits of breastfeeding.
Absolutely.
And also I will always say too, like breastfeeding up for at least 2 years as well, if you can, right? Because the palate is growing that entire time. Is that right?
When anthropologists who have really looked at prehistoric skulls or pre-industrial skulls have found that they were very well developed. The jaws were very well expanded and forward. And that is linked partly to the increased chewing required because our food was less processed.
They had much less processed food.
Yes, but also breastfeeding as well. So what they found through fossil records is that babies were exclusively breastfed for 6 months, and many were mixed-fed until 3 months. So that's one of the reasons why the jaws aren't developing as strongly.
Yeah, that's really good to know. Are there So are there bottle nipples that are better for developing the palate, or are they all sort of similar?
Yeah, I don't really think that's within my scope to
Okay.
comment on. I'm not really familiar. I usually would refer to a lactation consultant, and
Yeah.
there are things like pace feeding, making sure that babies are extracting it in, not overdoing the compensations and not over sucking, and
Yeah.
yeah.
No, I really will tell all families, regardless of how they're feeding their baby, breast, bottle, um, to see a lactation consultant at some
Hmm.
point for this reason and many others as well.
Hmm.
But I'd never heard that that if a baby was functioning at the breast well enough, that there could still be a latch issue. So that's really even more evidence for people to have a lactation consultant come over and take a look and see what's going on.
Yeah, absolutely. Even myself, before I got into this, I have two children who are now 18 and 15. But I breastfed both of them, but now that I've been involved in this, I can actually realize they had two very different problems where they were not breastfeeding well.
Mm.
So one of them, I did have mastitis, some sort of soreness, and she would feed for like 30 minutes on each side, and I thought that was quite normal.
Yeah.
Whereas my other one would feed very quickly. I thought, oh, she's a very efficient feeder, and
Yeah.
she always needed to be held. And then when I've looked back at baby photos of her, I've gone, oh my gosh, she has all this white milk
Oh, on the tongue.
coating on her tongue, which actually means that she was not effectively draining the milk with her tongue. And yeah, she was one of those children that grew up and she could not swallow her food. She would eat her food and the meat would just stay in the mouth and be pouched or spit out.
Mhm.
So it affects their swallowing, and that becomes other problems as they grow older.
Yeah. I was recently told that I also have a tongue tie, and I have so much pain here in my
Mhm.
neck. And it was a very brief. I have to do a full exam, but they did a brief one, and they were like, "Oh yeah, I can. You probably have neck pain." I was like, "Yes,"
Mhm.
because my tongue is fully compensating. My other muscles in my neck and head are
Yes.
compensating for the tongue not doing the right thing. So such an interesting field. And as I shared with you too, it's like everyone in my family's going, I'm gonna now get this checked out
Mhm. Yeah.
for all kinds of reasons. Um, Wonderful. So you talk about sleep and breathing as family health issues, not just children's issues. How can this affect the whole family system?
Yeah, well, when a child doesn't get good sleep, quite often the parent doesn't get good sleep. So that's
Yeah.
not great for anyone.
Yeah.
Um, and you know, I think for infants, it can really definitely affect that attachment, that early attachment, um, and how attuned a parent is able to be to their child.
Yeah. It's so much more
However,
challenging.
yeah. And then as children grow older, it becomes the behavioral problems, like children that aren't able to regulate well,
Hmm.
um, and they may be more prone to tantrums or behavioral difficulties,
Yeah.
which then take up a lot of attention, and that affects other children in the family as well.
Mhm.
Or, for instance, I had one mum who her child was quite sick and she had to take off so much time um, to look after her child, who would always be not able to go to school. And she had to give up her studies and wasn't really able to complete her own life well.
Yeah.
So, yes, there's a lot of different ways. In a way, when we treat children, we're treating the entire family. And like last week, I had a mum who, every time she calls, our team feels a little bit, it is hard to please this lady.
Mhm.
She's a little bit more grumpy and fussy. But when I spoke to her, she just said, look, my child is not sleeping well. And I'm getting told his attention is lacking in school and people aren't listening to me. He goes to sleep for normal amounts of time,
Yeah.
but he's just not breathing well. And it stresses me out, but it makes me nasty to people when I don't want to be nasty to
Yeah.
people.
Yeah.
So when we treat a child, we're treating that whole family, but how that mum can show up in the world for other people as well.
It's
So
such an important
yes,
way to see it
definite
that way.
impact.
Yeah, absolutely. So for our parents listening now wondering, how is my child's airway health? What are some kind of red flags? What kind of things should parents be looking for before they come and see a dentist?
Yeah, absolutely. So I think a lot of time parents are really happy. They say, my child's a really good sleeper if they don't need to wake up for their child
Mhm.
during the night.
Mhm.
And they're often not really aware of what their child is actually doing. But I think it's really important for parents to recognize that when a child is sleeping, we want them to be silent. So any sound is a signal that there may be difficulties in airflow. Yeah.
Yeah.
And we want them to have their mouth closed, breathing through their nose, and be looking relatively peaceful. So we don't really want to have tossing and turning and sweating because
Mhm.
they could all be signs that a child is not getting good restful sleep or working harder to breathe.
Yeah.
So really the key red flags as mouth breathing, snoring, teeth grinding, bedwetting, um, tossing, turning, sweating, drooling, uh, any nightmares or terrors, frequent ones.
Mhm.
Sometimes children will go into their parents' room
Mhm.
and want to sleep there. And a lot of the time it is actually because they've woken up. And sometimes that it could be a breathing issue. And
Right.
these children may be more prone to going into their parents' rooms.
Yeah.
And so when a child wakes up from sleep, we want them to be in a relatively good mood, not too grumpy, and they should feel rested.
Yeah.
And during the daytime, things like difficulties with emotional regulation, poor attention and concentration, or even anxiety and separation anxiety even. I've
Mhm.
seen these symptoms improve when children can actually get good quality sleep.
Yeah, that makes sense too. If they're restored and more regulated, then they can
Mhm.
handle challenges much
Mhm.
better. Um, that's great. Yeah. So one other one I see in like the little ones are babies who want to sleep like on their parents because the
Yes.
angle is more optimal for them to breathe, or they sleep with their heads
That's right.
arched
Yeah,
all the way
that's
back.
another one. That sort of CPR position where we're thrusting our jaw forward or tilting our head back, or even stomach sleeping. When a child is sleeping on their stomach, I'm always thinking, what is their tongue doing? Because if the
Mm,
tongue is properly resting, lightly suctioned to the roof of the mouth, that is when we're going to get our optimal breathing. Whereas if the tongue is low, um, it's more likely to collapse into the back of the throat if we are sleeping and our muscles are more floppy and relaxed and we're on our back.
yeah.
But stomach sleeping, and some of the little infants that are stomach sleeping with their bum in the air, that can
Yes.
actually be quite protective uh, against base of tongue obstruction of the airway.
Yeah. So sometimes I have parents, we ask them in our consults, any mouth breathing, snoring, a lot of the things that you mentioned, the positions. Um, and it's impossible to have your mouth open with your tongue up because when your tongue's up, you cannot breathe through your mouth. But
Mhm.
for our little ones, sometimes if their mouths are closed, I'll still ask the parents gently open their mouth to see if the tongue
Mhm.
position is there. Um, and sometimes that's the case too, right? The mouth is closed but the tongue is not sealed and suctioned, and so they probably need some help as well. So if parents do see any of these things that you've mentioned, they're listening to this and they're concerned, where should they go for help? What's the best place, what the best people to see?
Yeah. Uh, Given that a lot of your audience has infants, um, I think it's great that there's a lot of sleep consultants that are really now less about, sleep behavior and also considering feeding issues, because I do think that when we have poor feeding or gulping of air, that is really a common source of sleep disturbance for
Mhm.
children or infants. And so if there is any feeding difficulties or if there is gulping or intake of air, definitely see a lactation consultant. And we know that, for instance, the one that I work with the most prominently, she actually gets quite a lot of referrals from sleep consultants. So it's fantastic to see
That's
people are
great.
looking out for that. Sometimes an ear, nose, and throat specialist if there is quite clogged up breathing. they may be an appropriate person to seek consult with. So they're probably the main people in infancy. And then as children get older, I personally will see children from 4 years and above. And then we're looking more at the jaw structures, and we're really assessing for the tongue function and how the muscles of the mouth are working. And myofunctional therapists can actually help promote good oral function as well. But I do want to say sometimes, a lot of parents can really worry about it. And sometimes it's really hard. There's that really difficult age from infancy through to 4 years old, which the options are quite limited. It's almost like ENT, or, if they don't do anything, people become stuck.
Yeah.
So you can see a speech pathologist who has training in feeding and do activities to get the mouth working better, making sure children are chewing and swallowing better. But realistically, for a lot of kids, I do find that palate expansion or widening the upper jaw is a very central intervention that can shift a lot of things, making more room in the nasal passages and more room for the tongue to allow things to function more effectively. So I think one thing that parents can take home is that if we have a narrow palate, it is an airflow limitation, and you don't have to wait until a child is 12 when all the teeth are crooked and take out teeth. You can actually do early intervention to modify that palate. And there's now a lot more pediatric dentists doing early intervention with palate expansion.
Is airway dentist, like looking for an airway dentist, is that something that people should look for, or sort of?
Yeah, you want to look for a dentist who is specially trained, who has a special interest in airway health, for sure. Yeah, and one of the key changes that has occurred in 2017, the American Dental Association, they issued a policy statement for the dentist role in airway conditions or sleep-disturbed breathing, and they suggest that all dentists should be involved in screening for these problems in children, and they have a role to modify the airway to optimize breathing. And so that is why more and more people are becoming on board and learning about it. But it still can be very difficult because it's not something that's routinely taught in dental school. A lot of people have had to go and get extra learning to do it. So yes, it is quite difficult sometimes, but it's a growing area. And for the listeners, your listeners now who have infants, hopefully there's a lot more change in the next 4 years.
Yeah, absolutely. Well, you've shared so many wonderful pieces of the story with us, from prevention to detection, and then a plan to work with it, which is really, really wonderful. So thank you so much for being here. Is there anything else that you'd like to share with us? Parting words?
I think really, recognizing that airway health is so important. When we have problems like obstructive sleep apnea and snoring, these really have their developmental origins in early childhood, in how the mouth is working, how the mouth is growing. And people who have infants are in the perfect position to be able to get educated and know what are all the opportunities. If we miss one opportunity, there's going to be other opportunities. But the earlier we're aware of it, the more we can actually make good choices. And that's what my book, Breathe, Sleep, Thrive, is about. It's really about letting parents know what are the red flags from breastfeeding and onwards to how the teeth are growing, and where are the different treatment pathways as well, because it's not always just one thing like ENT surgery that will cure a child.
It's so important. I feel like for our parents also to just have so much compassion for themselves as they go through any sort of journey looking into this, because like, as you said, if we didn't know that we could, do an intervention 2 years ago, we know, right? And so
absolutely, I think we as dentists, sorry to interrupt you, Greg, but we are still learning, and every day I'm still learning as much. So just we do have to realize that we're all doing the best that we can.
Absolutely. I shouldn't have thought about saying goodbye without one more topic that had just popped into my head. One more prevention topic that we should at least comment on, are oral ties too, right?
Mhm.
So that also impacts tongue function and jaw development, palate development. Would that also fall under the category of make sure you see an IBCLC
Yes.
very, very
Yes.
young?
And also make sure that you understand that some are not attuned to tongue tie.
Yeah.
Because really, when it comes to tongue tie, it's a very confusing topic. I see people that have had these problems with feeding and air intake, and they have seen multiple professionals.
I've seen
Sometimes
that
like
too.
20. And they're told, oh, this problem is something that your child will grow out of. There's no tongue tie, or there's a tongue tie there, but it's not going to impact anything. And what people often don't realize is we don't get any training in tongue ties. Like, we're dentists, we're oral physicians, but we don't get taught about it. Speech pathologists don't get taught about it. Lactation consultants don't get taught about it. So no one really gets proper assessment and training in this area. You have to go to someone who really does have a special interest. And often we develop this special interest because of our own experience with it. So there are more and more people that have it, but recognizing that sometimes you may actually get misguided if you haven't chosen the right lactation consultant. There's quite a lot of difference between them.
Yeah. That's why it's so confusing for parents out there. So would you say then a dentist who works with ties frequently, would that be a better person to have an assessment with?
Yeah, check with that dental office who are the lactation consultants that they can recommend. Because if I see someone that's called us, I still need to send them to a lactation consultant for a feeding evaluation.
Got it. Beautiful. Thank you so much for sharing that with us.
Thank you, Julia.
Thank you so much for being here. I'll remind everyone to check out your wonderful book. Here it is again, Breathe, Sleep, Thrive. And for anyone who wants to learn more about you and all the things that you're working on, where can they find you?
Yeah, well, I have recently launched a website for the book called breathesleepthrivebook.com. Really, my goal is to bring this information out to more people, more healthcare professionals, as well as parents, so that we can allow more children to thrive to their full potential. But otherwise, my website, drShereenLim.com.au, as well as Facebook and Instagram. Yeah. But the book is also available on Amazon. So that's got the widest distribution.
Wonderful.
Check it out there too.
Amazing. Well, thank you again. We will put all those links in the show notes, and such valuable information that you're sharing. And thank you so much for your wonderful work.
No, thanks very much for having me. I appreciate it.